Honorable Zuleika Cooper described this year's theme, End Malaria for Good, as a call of desperation for more support and investment to reduce the prevalence of the disease. She said malaria fight is one of the most inspiring global health stories due to the saving intervention, which has subsequently resulted in a consistent reduction in global malaria case and death over the past years in Sierra Leone. Malaria remains one of the prime causes of death among children and the biggest cause of medical consultation and hospitalization. And it is in this vein that her ministry, in collaboration with its partners, has stepped up to prevent and treat the disease.
In Sierra Leone, malaria still remains one of the prime causes of death among children and the biggest cause for medical consultations and hospitalization. Against this backdrop, my ministry and the government of Sierra Leone, through the National Malaria Control Program, in collaboration with international and national partners, has stepped up its commitment to scale up the proven and cost-effective tools currently in existence to prevent, diagnose, and treat malaria.
Mayor of Freetown City Council, Franklin Bobby Gibson, said Freetown City Council and the Ministry of Health and Sanitation have moved stages ahead to arrest individuals who are in the habit of littering surroundings. In addition, the Freetown City Council now has its court, which tries anyone found wanted.
City Council and the Ministry of Health and Sanitation, we don't move stages ahead now. Now we arrest people for the own yard where they don't keep clean. Then yard there, when they dirty water, that they when they throw dirty cup and bottle, when they breed malaria, we arrest una for that. The bad news for una, which is good news for me, that the fact that Freetown City Council don't get a court inside law court building, court number 3, where they will try people them for dirty and for other municipal cases there.
Dr. Anders Nordstrom said malaria is one of the most important health issues they have in hand at the moment. He said despite the progress that have been made in combating malaria, it remains the utmost priority in the world because every year 214 million people are being infected by malaria, which means more work needs to be done.
Even if progress has been made, malaria remains a major public health and development issue and priority across the world. 214 million people are still affected by malaria each year, and you saw on the map where those are. Actually, more than 80% of the global cases and 90% of the deaths is happening in Africa. And 13 of the 15 most affected countries are again in Africa. Sierra Leone, the estimate is that there is 1.5 million or 1.4 million people affected by malaria each year. This is a very large number. And 2,500 mainly children dying from malaria each year. We see now that we've made major progress rolling out access to treatment, diagnostic, bed nets, etc. We need, I think, to be even more rigorous in terms of monitoring, also that we do reduce the number of people affected and also actually people die. Because a lot more needs to be done in order to be able to come to zero.
World Malaria Day was established by World Health Organization member state to commemorate World Health Day on April 25th, which was meant to highlight the need of continued investment and sustained political commitment for malaria prevention and control. Star Television, Rebecca Sugba reporting in Freetown.